Let's bring in former Republican presidential candidate, Fox News contributor Herman Cain to the conversation. Herman, good to see you, sir. Thanks so much for joining us.
Morning.
So we've been talking a lot about some of these taxes that go away with this plan, which obviously is a big deal for business, small business, for them to create new jobs. But what are the tax implications of this repeal and replacement plan from your standpoint?
From my standpoint, Maria, by the way, you and Dagan and John and Morgan, you can call me Happy Herman this morning because I am happy with this tax plan.
Good.
And here's why.
Okay.
It is Obamacare gone. Mandates are gone, taxes are gone, penalties are gone, and it's going to reestablish the health care marketplace and the health insurance marketplace. And as you all very well know, that means competition. And so what that means is that the tax implications are going to be that businesses have more flexibility to grow their business and to provide the care they want to care, and consumers are now back in charge. One other quick point. The fact that President Trump supports this, the fact that Speaker Ryan supports it, and it's built off of the Tom Price Patient Empowerment Plan, that is a huge advantage. Now, all the Republicans have to do, quite frankly, is not screw it up. It is a great plan.
But, Herman, I'm going to push back on that. And to the man who was tweeting nasty tweets at me about always being negative, I'm going to be a little negative about this. A tax credit, they get rid of the subsidies, but a tax credit is still a government handout for people to buy insurance. And could it have gone further with the Republicans getting rid of that Cadillac tax on very costly employer-based health insurance plans? That doesn't go away. It gets kicked down the road, but it still comes back in 2025.
Here's how I look at that. First, let's talk about the tax credit or the refundable tax credit. Read Section 15 of the Ways and Means Committee summary. Read it very carefully, because you don't get that refundable tax credit if you work for a company that offers health insurance, or if you participate in a government health insurance plan like Medicare and Medicaid. So when you do that, the number of people that would actually get that is very small. Granted, it is like an entitlement, but that's going to be a very small number of people that would qualify for that. As far as the Cadillac plan, the way I look at it from a business standpoint, it gives businesses several years to adjust their plans to take care of their employees in order to be able to avoid the Cadillac plan. I predict by the time that time period rolls around, no companies will be in jeopardy of being hit by it. That's what it's doing.
To that point, Herman, you're
time.
right. You're actually right, because the Cadillac tax was supposed to kick in next year in 2018.
Yes.
And you've seen a lot of businesses already bring down the kind of value of the health insurance that they offer to their employees.
Because once they know that it's going to get better and they're not going to see as many people as they thought get that tax, they can start making plans to actually invest in their businesses with that savings, right?
Herman, do you
because see what businesses are going to do, and what insurance companies are going to do, what healthcare providers are going to do, they've now got to reestablish the way they do business. Keep in mind, Obamacare blew up the building with a hole in the roof and left it in splinters. And so this new legislation, it's got to preserve the gas pipes, preserve the electrical lines without blowing it all up again, and rebuild it. That's why this is partly unraveling the mess created by Obamacare, but at the same time put in a structure that's going to be solid, and a structure that empowers patients and empowers providers.
Herman, what made Obamacare so unpopular was these huge premium increases we saw in states all over the country. Explain how you think this alternative is going to bring down those premium increases and control costs for individuals.
The way it will bring down those costs is that it will allow more insurers to go into particular markets. Right here in Georgia, over half of our counties were down to one provider. And whenever you have one provider, the rates for premiums will skyrocket. Now that you're going to open up competition and reestablish the health insurance marketplace and get rid of the things that were discouraging insurance companies, that's how rates are going to come down. competition among insurers.
What's the change that causes all this competition that you're talking about?
Well, one of the biggest changes that causes this competition is no mandates on the companies, on businesses, and the government will not predetermine what coverage you ought to have. That was the other big thing that drove up rates, because the government was saying you had to have things covered in your insurance that you either didn't need or didn't want. That goes away. So as a result, you can define what you want your health insurance package to look like, and the insurance company will tailor a package and a cost to fit what you are asking for.
Yeah, that's a great point. Herman, let me switch gears. I got to ask you about this other story, which is pretty surprising. Americans are renouncing their citizenship at record rates. 5,000 Americans forfeited their citizenship in 2016. This is according to federal records, 26% higher than 2015. The reason that they are citing for those handing in their passports, the tax system. Unlike other countries, American tax is based on nationality rather than where you live. Are you surprised by these statistics?
I am surprised by these statistics, but I believe that those people that are renouncing their American citizenship are making a big mistake. Here's why. Tax cuts are coming. They're looking at it very short term, and I think that that is a very short term way to look at it. Tax cuts are coming. The only question is when and how much. So to do it based upon tax rates alone today, I think is a very short-sighted decision.
All right. We will leave it there. I think it's a short-sighted decision also. And for
Yes.
taxes. I mean, go to Europe and you've got, where are they going, by the way? Canada?
Well, Barbara Streisand said she was going to go to Australia or Canada, and she hadn't left yet.
That's true. And Cher said she wanted to go to another planet. So,
I think
There's
she's already
a
there.
rocket
Yeah.
ship
there you go.
going to be going.
Herman, thank you. Great to see you, sir. We appreciate your time this morning.
Thank you.
Herman
I enjoyed
Cain
it. Thanks.
Joining us there. Stay